Hello, this is Shirley Breath, and I'm going to talk to you today about how I plan to utilize the National League of Nursing's Nurse Educator Competencies. The first one is facilitate learning. The way that I facilitate learning in my classroom is by use of team-based learning. The teams are divided up on the very first day of each semester by asking a group of questions and then dividing the students up in this way, and they sit in those same groups throughout the semester. This helps to promote student learning, collaboration with peers, and to develop an ethic of responsibility to self and others. I'm going to begin the use of concept-based curriculum this semester, and this is to keep in line with other colleges and universities. I will be utilizing the curriculum by Giddens, Caputi, and Rogers. Officially, I won't be doing concept-based learning until the spring of 2016, because the MedSurg 1 students will be getting the new textbook this fall, and then they will continue on with that textbook in the spring of 2016. But I'm going to go ahead and start developing my concept-based curriculum for fall, and just keep working on it so that it is becoming perfected come spring. I will continue to be flexible with my students to meet their learning needs. I plan to meet one-on-one for counseling with students that are at risk, and also I want to meet less often with non-risk students, and that will help boost their morale and their confidence. I'm going to work closely with other instructors who are teaching MedSurg 2 evenings and also MedSurg 1, and we're going to develop an understanding of concept-based teaching together, and also work on creating activities and test questions. Number 2, facilitate learner development and socialization. Identify learning styles of students by working closely with them during class activities, one-on-one meetings, and observation of assignments and assessments. I will also discuss this with the Foundations and MedSurg 1 instructors as they do learning style identification during the first semester. I will meet one-on-one with each student at least once during each learning module, and more often if they're at risk. I will continue to help develop self-reflection for students through reflective journaling as the activity in my clinical course that I developed, probably about 4 or 5 semesters ago. Students really struggle with self-reflection. I want to develop a peer evaluation survey to use in my didactic class, and this is going to help students learn from their peers how to be an effective team member. I'm going to continue to present items of interest from NLN and ANA publications that I receive. I also enjoy sharing information that I have read in scholarly journal research, and this also helps the PN student learn that nurses are also scientists. Number 3 is use assessment and evaluation strategies. I'm going to use the scratch quizzes as a group formative evaluation for each lesson in each module. This will help me be able to track students that are indeed comprehending lessons and those that are at risk. Writing, along with 2 other instructors, effective application level test items by using Bloom's revised taxonomy. And in the PN program, 65% of the MedSurg 2 questions must be application level or above, and all the test questions are written in NCLEX style. I will perform item analysis of each module exam with at least 1 other experienced faculty to assess the effectiveness and fairness of the test items. I will continue to learn from exam results if teaching learning methods are effective. Number 4 is participate in curriculum design and evaluation program outcomes. I am working one-on-one with the program director on program evaluation in preparation for the Kansas State Board of Nursing site visit in the spring of 2016. I will work with the other MedSurg instructors on creating concept-based curriculum. I will work with the ID&T team on creating master courses in Blackboard in order to align all of the MedSurg 2 courses. Number 5 is to function as a change agent and leader. I will continue to discourage cultural bias when speaking of foreign students during faculty meetings. I will continue to develop innovative ideas for the classroom. I will participate in the interdisciplinary consortium on simulation, which involves KU Med Center and also Newman University. I will continue to promote the use of concept-based curriculum by using it in my own classroom successfully. Number 6 is pursue continuous quality improvement in the NURS educator role. I will continue my commitment to lifelong learning by completing my MSN-NE and obtaining the NLN's CNE certification. I will continue obtaining more than the required 30 CEUs per 2 years for a minimum licensure renewal by attending educational conferences. I will continue to work with ID&T to learn new technologies and programs to enhance student learning. Number 7 is engage in scholarship. I will continue to use evidence-based teaching within the classroom. This is going to require me to keep up with the current educational and technological curriculum even after my MSN-NE is completed. I will participate in a conference by submitting a poster presentation. I will learn the proper way to write for the site visit of the KSBN that is coming up in April, and I'm going to work closely with the program director on this. Number 8 is function within the educational environment. As I finish with my graduate degree, I see myself working with those at the state level to advocate for nursing and higher education. I also want to continue to work on my own learning of teaching and perhaps move on to teach at an ADN or BSN level. I also consider becoming more involved in the Leadership Council at WATC. There are some changes coming. Our president has resigned and is going to move on, and as a school looks for another president, I will watch for opportunities that may arise. Thank you for listening to my presentation.